Welcome to Senior Stay or Go TV, a show to educate, entertain, and advocate on behalf of our aging adults. We are here to provide you the best information for your quality of life.
Hi, everyone. My name is Patti Gerke. My business partner, Ron Greenwald, and I are doing this webcam this morning because we have been inundated with information regarding the COVID-19. As you can tell, we are all sequestered to our homes to be able to do this webcam. And we are also extremely fortunate to have Dr. Rebecca Montano with us this morning. She is an aging life care manager and an elder care mediator with over 30 years of experience working with both individuals with disabilities as well as individuals who are experiencing changes and challenges associated with the aging process. She has a PhD in human services with an emphasis in geriatrics and a master's degree in rehabilitation counseling and a master's degree in business administration. Her philosophy on working with aging adults is focused on dignity, individualism, advocacy, education, and preservation of value of the key elements that make life happy for all of us. So thank you, Dr. Montoya, for being with us today, and we really appreciate your perspective and your expertise regarding this situation and crisis and pandemic, whatever we call it, that we are experiencing today. So, Ron, I know you have some personal questions because both Ron and I are of the age to be concerned according to the experts. And so, Ron, I'll let you ask your question to Dr. Montano.
Well, Doc, thank you for being with us today. I really appreciate it. And you and I have gone back a long time and have served a lot of clients together, and you do incredible work. And I appreciate all the work you do on behalf of our seniors. So thank you.
Thank you.
So since Patti and I are, I guess, officially over the age of 60, and we feel that we're healthy individuals, I'd like to address two things. One is, should we be out volunteering and put ourselves out there in the space of volunteering to help others? And two, last night, obviously, Governor Newsom we're here in California, and New York announced today a shelter in place, I guess, is that what they're calling it?
Mm-hmm.
I'd like to address both issues. One is, what should Patti and I be doing or concerned about, and then what about the shelter in place?
Okay, so one thing that's important to know about the coronavirus is it is impacting people of all ages. People over 60 who have chronic illnesses are probably our biggest concern. So things like diabetes, congestive heart failure, hypertension, dementia, anything that puts them at a greater risk naturally for infections. So that's why we've put this over 60 situation on there. If you are a healthy 60-year-old, 60 plus, I think it is okay to be volunteering as long as you are taking the precautions that have been put out, which is washing your hands frequently, not touching public entities like doorways, handrails, all of that sort of thing. If you do, for example, going upstairs, you should use a handrail. If you have to do that, absolutely wash your hands immediately. Do not touch your face, your eyes, your nose, ears, anything like that that spreads that germs. And just practice, that distance requirement of 6 feet from people. So there are several of us who are extremely healthy as we are older. We're not all, have other health conditions that preclude us from this, but we still want to be extremely cautious.
And what about wearing gloves? I mean, is that actually a real help in this situation?
Well, gloves are helpful if we are removing them afterwards. So if we have gloves and we're touching rails and then we touch our face, well, we've now still contaminated ourselves. The gloves are helpful if we are, walking up and down stairs and then we're taking them off, throwing them away, and still washing our hands. So the best practice is really using the hands. And what I'm advising the caregivers and the families that I work with is to use the gloves for personal care with the older adult that you're taking care of, and then removing them and using fresh gloves as we would in any situation normally.
Patty? Oh, Governor Newsom. Let's talk about
Governor Newsom. So yes, last night we had a stay-at-home mandate from Governor Newsom, which means that all of us who are not essential workers should be at home. We should be working from home, playing at home, doing whatever we need to do at home. What that means, essential workers are any healthcare providers, doctors, nurses, respiratory therapists, all the folks that we see in clinics and doctors' offices, hospital settings. But also that means caregivers for older adults, aging life care managers like myself, and then we do have the need for volunteers to assist with some activities. Now, keep in mind that volunteerism does not need to be out in the public. It can be done from home. So calling seniors who are at home, for example, would be a really great thing. If you have seniors who you've worked with in the past, Ron and Patty, who are at home alone, maybe a little isolated, pick up the phone and say, hey, I'm just calling to say hi, see how you're doing. Tell me the story again about how you met your wife, or where you went to college, and engage them in some conversation. I think that's one of the best ways to battle some of the isolation that our seniors are experiencing. So back to essential workers, those of us who need to be out in the field are out, but we are limiting if we can do something by telephone or teleconference. And we are also trying to check in on people as much as we can.
So based on that, and I don't disagree, if someone does start to feel sick, what should they do? Should they, they're saying if you have mild symptoms, just stay home and rest.
Right.
Don't, contact your doctor. They're overwhelmed right now. But again, sometimes when you're isolated, you make mountains out of molehills.
Right.
And you might make calls that maybe you shouldn't be making. So what are you suggesting to your clients and their caregivers?
So my clients and my caregivers have a direct line to me, so they can call me if they're starting to feel sick, but not everybody, has the privilege of having an aging life care manager at their disposal. What we are doing is we're taking people's temperatures frequently, especially if they're not feeling well. Even though I did hear some information yesterday that not all fevers are indicative of coronavirus, and there are some people who are not having fevers. I don't know how true that is. I'm not a physician, I'm a care manager. But I think we have to use precautions as we would normally with the flu. If we have an older adult who is experiencing flu-like symptoms, whether that's a fever, a sudden cough, sore throat, runny nose, all of those things, I think it is wise to put in a call, or if you have a My Chart or electronic access to the doctor's office, send a note. If you don't hear back, then give them a call. But I wouldn't be rushing people to the emergency room or urgent cares, because if you are, like you said, Patty, going a little stir crazy and starting to think like, oh my gosh, I have this, and you end up in the emergency room right next to someone who does, you have just, put yourself in harm's way when maybe it was something simple to take care of. With that said, I would like for families and caregivers to be aware of, what is the normal activity and baseline health of the person of each person in your home, whether that's yourself or your older adult, and really think about, is this changing? Is this significant? Don't mistake it for something that it isn't.
Good point.
It is hard. Yeah, it is hard to tell.
That's a very
but
good
we
point.
need to really kind of reflect on, I'll give you a perfect example. Yesterday, I was sneezing in the morning, and my husband immediately said, oh my gosh, you're sneezing. And I said, I sneeze every morning. Once I take my allergy pills, I sneeze on average about 20 times, and then I'm good. This is my allergy sneeze, right? I just take my pill, I'm good. So
And it is
Those are
allergy season, so.
It is allergy season, right? So we want to be aware of what is our normal when we don't have a pandemic surrounding us and hearing this all the time on TV.
Well, and with a senior, if they're not drinking enough, which oftentimes they don't, and they get dehydrated, they can get delirious or get a UTI, and those changes are pretty dramatic. Those aren't even simple changes.
Yes. So I think you bring a really good point up, Patty, and that is, even especially since we are home, we cannot stop practicing safe, proactive procedures like hydration and proper nutrition. Coronavirus is not in our water system. It is not in our grocery system. So please still make sure you are hydrating sufficiently. You are, eating as you would normally. For people who are older adults who are incontinent or have frequent UTIs, let's make sure we're still changing them as we would normally, giving them lots of water, using any of our tricks and skills to get them to drink and eat. And one thing I would also recommend is let's not watch TV and news 24 hours a day.
Amen.
I think that creates a lot of anxiety and a lot of panic for some people. So I really, truly believe we need to be informed, but let's limit it. Maybe, an hour or a half hour in the morning, and then sometime mid-afternoon, to make sure that nothing has come up and don't need to be aware of another announcement, and then maybe in the evening before we go to bed. So I would definitely limit news watching if you're not someone like one of us who needs to be aware all the time of what's happening. Limit the amount of news you watch a day to maybe 3 hours in total. So
totally agree with that one. Yeah. Can't agree more with that one.
Yeah.
It could make you crazy.
I know. And there's lots of other things to watch, lots of game shows and,
Jeopardy,
History Channel and sports and you name it, right? So let's just, use our clickers and move it along the way.
Well, and with streaming today between Netflix and Hulu and Amazon Prime and Apple TV, there's all kinds of things you could be doing.
Exactly.
I think everybody's
I'm actually reading a book.
Yeah.
Oh, good for you.
How about that? Let's read.
Not an Audible. Oh, got my hands up. Yeah. Not an Audible, but an actual, you turn the pages, the old style reading books. So I'm enjoying that. So I'm actually engaged in that. So, Doc, I want to move it to a little bit of do you see this? Is this a tipping point for your practice and the whole Aging Lives Association's practice in terms of encouraging more people to be preemptive and have plans in place?
Well, and does everybody really understand what an aging life specialist is? Maybe you can start with that.
Okay. So aging life care managers or aging life care specialists, we are professionals in the field to help people essentially navigate the changes and challenges associated with aging. We are a wealth of resources, and we can do things as simple as getting you started with a plan of care, all the way to helping manage your entire care. And the majority of us are social workers, nurses, or some type of related, like I am, profession. And we work closely with a lot of other aging professionals, whether that be physician groups, therapists, folks like Ron and Patti, etc. So we know what is out there as far as resources and availability for assistance. At Aging Focus, which is the company that I own, we have what's called a bridge program. And our bridge program is for healthy older adults who want to have a plan, and they want to have somebody at their side in the event of a crisis. And the way that works is there's two options. You can meet with us once every 6 months, and we can look at the plan, revise the plan, and we talk a couple of times within the year to make sure that we know you, so that when things like this occur, we can assist, right? We're not working blind. The other program is a little bit more involved. We see you quarterly and talk in between. These are good options, especially for our new family situations where a lot of older adults live away from their children, and or their children have robust careers where they might not have the time to be able to devote to an older adult and the things that they need. So this is really where our position is very effective, because we can step in and help. And it doesn't have to be a, every day or every week or every month relationship. It can be something that we assist with every 6 months to review what's going on with that individual, create a plan, and help put in the resources that they need during that time frame. I've gotten a couple of calls from other professionals who do things different than I have, asking, what I think this means for the aging profession. And I think as long as we all stay calm and we continue to support our older adults, this can only bring awareness to not only the generation that we serve, but also the different professions that are available to assist.
Great point. I mean, I think this has really brought to light what Patti and I and you have been talking about for years, is that we really need to be more aware of the senior, I say senior space, I'm saying 75 plus, yeah. Where they need to have some support because they just don't have the guide to weave and guide your way through all the nuances of Medicare and hospitalization and Medi-Cal and all that. There's no way a human being can understand that process.
Even family members, it's not something they do on a daily basis. So it's hard to be informed and get informed rapidly enough to sometimes make a difference.
Right. So having somebody who you can call and say, exactly, hey, we're facing this situation, we need your help. Which direction do we take? Yes, it's going to cost you a little bit to have someone on staff like us, but we buy insurance for our cars, we buy insurance for our homes, we buy insurance for everything else. Why don't we, spend a little bit money on our own aging and well-being?
I think you're going to like that comment.
That's perfect. Yeah. Ron's going to steal that.
Okay. Ron, I'll share it with you.
Again, I want people, how do we are you willing to talk to more people at this point in time? And
yeah, Ron and Patti, you know me. I am always willing to talk to people. I've had lots of people contact me before this pandemic, during this pandemic, and I'm sure afterwards. And if I can just steer someone in the right direction quickly, I am willing to do that. I know a lot of my colleagues are as well. It's when we start doing, actual care management over the phone that we say like, oh, hold on, let's talk about actually, getting onto services. But when it's, quick information, we're more than willing to help.
And how do you want people to get a hold of you? What's the best resource?
They can either email me at agingfocused@gmail.com, and that's agingfocused@gmail.com, or they can call me at 858-695-2369. So 2369. Or look
Patti, I'm just trying to, with the overall, you think, I know we're not experts on this, and do you think we'll be through this by the end of April, or is this going to go on to the summer?
Well, one of the things that I attended a webinar yesterday with a physician who is closely linked to the CDC. And one of the things that she was saying is that if we can all do our part, which is if we do not need to be out, don't be out. If we can stay in place, follow this mandate that Governor Newsom has implemented, and stay home, we can start to significantly reduce the number of people that could potentially be infected. If we do that, the time frame for this is going to be cut significantly. If we decide that we are just, can't stay home and we need to be out and we need to, not be washing our hands and touching things and, being close to people, we will see this go into the summer. Now, with staying home, I do want to say that one of the things I learned yesterday on this webinar is a really great way to break the monotony of being indoors and isolated is take a walk around the block. There's nothing prohibiting us from going outdoors. In fact, being out in the sun is good not only for our spirit and our quality of life, but it's also, according to the physician that I heard yesterday, the UV rays are actually a great way to kill virus. That doesn't mean, get in a group of 20 at the park and have lunch. That doesn't mean go to the beach like we saw folks in Miami doing. That means, go for a walk around the block. And, maybe if we all do that a couple of times a day and limit our news, we'll just increase our quality of life. And, like you said, Ron, read a book. So there's lots of things that we can be doing to proactively occupy our time. And I think what's really important is we all have to keep in mind, this is temporary. If we all do our part, we will all be back in our usual day-to-day activities soon.
Actually, yesterday I got caught in the rain walking, and even that felt good.
Well, I think we're supposed to have a couple of sunny days coming up, so that'll be good.
Well, I just want to encourage. I mean, I just hope that everybody goes and takes out food. These people with these little restaurants, mom and pop shops. I really want to encourage people, if we can or when we can, to really go out and help these guys and go and order takeout food.
Yeah, I mean, takeout is an option, right? We can take takeout, and if you have an older neighbor next door who's isolated, give him a call and say, hey, I'm running over to such and such up the street and getting takeout. Would you like something? I mean, how much more neighborly can that be? And and maybe we can't sit and eat with them, or we shouldn't sit and eat with them, but we can drop it at the door and, call them on the phone and eat together that way. I mean, we all have these little gadgets. Every single one of us, even our older adults, have these little gadgets, and it's easy to put it on speakerphone or FaceTime or, whatever the case is.
Yeah, no, I appreciate that. Actually, it's my my stepmom's 89th birthday today.
Oh, happy birthday, stepmom.
We're going to try to do a mass FaceTime.
Yeah. One of my teammates sent me a really great screenshot of her trying to help an older adult learn how to use FaceTime with, text instructions and telephone. I mean, this is a time for us to, to share what we know with people, and patience absolutely is necessary, of course. But there's lots of ways that we can still connect.
Thank you. Patty, any
No, just, Ron and I are here. We are healthy 60-plussers.
Yay!
So if there is something you need, or you have a client that needs an errand run, medications picked up, anything like that, we're here and we're willing to help.
Patty, now you mentioned something that I want to also let your viewers and you all know too. A lot of the pharmacies are doing delivery. So if you are low on your medications and you need medication delivered, call your pharmacy and see if your particular pharmacy is doing delivery.
Good point.
And if they're not, then call Patty.
Call us.
We'll go get it. Right? Yeah.
Amazon is still delivering.
Yes.
I think
DoorDash is still delivering.
DoorDash, right. All those folks are still delivering, so that's great. Keep in mind, some of the items are running low in the grocery stores, so you might not get the exact brand of milk or the exact brand of eggs that you normally get. But again, this is all temporary, and you know what? You might find another favorite brand, right? So let's give it a try.
Time to choose maybe options.
Yeah, options.
Well, Doc, Patty and I thank you so much for coming on today and sharing. And just one more time, if you don't mind giving your email address and phone number, if people want to reach out to you and ask questions and get resources.
Sure. It's agingfocused@gmail.com. So that's AGINGFOCUSED. Make sure you put the ED on there, @gmail.com. And the phone number is 858-695-2369. And one thing I do want to say is, it takes 5 minutes of our time to make somebody else feel less lonely and more part of the group. So if you know of somebody, I would strongly suggest pick up the phone, give them a call, write them a note, anything just to let them know you're thinking about them. That is really how we battle this isolated situation.
Beautiful point. I like that. That's what, I'm going to
Great way to end.
I'll try get off this. So thank you for sharing.
Absolutely.
Patti, you be well. Doc, you be well, everybody.
Yeah,
and thank you for doing what you do. I know you are out there helping a lot of people and sharing a lot of great information. So you have a great day, and then hopefully we all can get together and toast a glass of champagne in the near future.
Absolutely. Thank you for having me, and everybody wash your hands and stay safe.
Absolutely.
Be well.
Thank
Talk
you.
later. Bye,
Bye.
guys.